LANAP offers a less invasive form of treating deep pockets and infrabony defects that will compete with continuing protocols that are traditional with grafting and biologic materials. I actually did a very thorough study because I really felt like laser was a new thing coming along, and I'm not a new periodontist, so I wanted to get younger and get more up to date. So I actually started studying quite a bit in 2010, and then I went with Millennium in 2011. Found out that Millennium actually did have a full training program that carries you for a good period of 1 year, starting with an intensive 1 week boot camp, and they put you through that even before they'll send you the machine, which I consider very professional. And then you have another 3 to 6 month follow-up, and another follow-up after that. In the case of even LANAP, treating cases that I wouldn't treat, or I'd be very hesitant to treat, because the invasiveness of the procedure that would be required might at first leave the tooth even more compromised. Certainly postoperatively, I would be concerned about some of these teeth having a cosmetic postoperative compromise. Having the laser go in there, go into the sulcus, do its work without detaching any more attachment apparatus, leaves less postoperative sequelae. And I don't mean ache and pain. I mean the cosmetic postoperative effects of the treatment, so that we have less gingival recession, less black holes and lost interdental papillas. And when you go through the protocol, they tell you exactly how to lase this tooth and move on to the next tooth, and don't duplicate lasing in the same. There's an interdental papilla. There's absolutely a firm thought about sparing tissue as much as possible to have the least amount of external soft tissue changes. As soon as I explain that this is yet and even another generation of treatment, right away now they're listening. Before they're kind of half listening, but they don't want to listen because they don't want to hear these horror stories that have been passed down to them from other people who've had traditional or old-fashioned treatment. So that gets their attention. But they're absolutely receptive to the idea of having treatment with a laser as opposed to scalp point sutures. It felt good to have people not be so scared of you or apprehensive about the technique, and be sort of looking forward to it. That's a experience that I certainly didn't have earlier in my career, and it's just nice to have people kind of looking forward to treatment. Don't miss out on a new procedure that's really valuable and really appreciated by the patients, just because of some of the political and controversial natures of this. But particular general dentists who have become increased referring dentists to my office, because they themselves have always probably learned from dental school that periodontal surgery can be complicated and leave cosmetic and structural defects. They just didn't want to refer their patients needed perio treatment, but they didn't want to refer them out for traditional treatment. This opened doors immediately when they found I was doing this kind of technique. I think it's increased case acceptance. It's simplified some of the post-op and some of the other periodontal procedure protocols that we do. We certainly do have the situation where we're doing crown lengthens, we're doing gingival graftings, we're doing sometimes root amputations or some sort of root and bone procedures, and all the appendic site development, things like that. It's not like once you have a laser, that doesn't mean you're going to throw everything else away and not do other procedures. And the laser is not going to help you with some of those procedures, but the laser is certainly going to help you with perhaps as much as 50% of what you do during the day. And How it affects me? Well, when you buy one of these units and you have a warranty, once a year you're allowed to take that unit, send it in, and have it kind of revamped and inspected and brought back up to specs. And when they do any updating, they do that automatically too. It's a great service, and it's well worth the money that you pay for it. When that unit's gone for a week, the schedule and the booking and what's being done changes. So that affects my schedule, and that's how having a laser and doing laser treatment has gotten into my practice.